I have a lot of questions about why we have the number of shots that we give our kids.
Vaccines. Let's have a vaccine discussion, shall we? We have some changes afoot thanks to RFK Jr. at HHS, Florida Surgeon General Joseph Ladapo, and others who are making moves and changing things up after what we saw, in my opinion, and I think many share it, I know Clay shares it, was the absolute abdication of impartiality, science-based medicine, and basic responsibility by the medical establishment during COVID, and that was during the early days when Trump was reliant on those agencies to act the way that they were supposed to at some level, and then during the Biden years where it just got worse and crazier and more absurd. I just want to tell you something that immediately annoys me is when anyone says they did the best they can, it was complicated. No, absolutely unacceptable. Because they weren't arguing then. They weren't arguing we need a vaccine mandate because things are complicated and we're not sure, but we think that this makes sense given. They were saying, shut your face. I don't want to hear it. You're not allowed to go to church. You're allowed to go buy weed, but get the vax or you lose your job. Get the shot or you can't go to a restaurant. We know what's true here. We know what the facts are. They did that, and then they were wrong on top of it. It is unforgivable. There is no excuse for it. And people in the medical profession who pushed this and went along with this should be ashamed of themselves. The airline attendants who were enforcing, masking at their whim. That in some ways was the absolute worst. Like there were people, and I know this has happened to me, there were people who thought, you know what? I'm going to go up to someone now. Your mask has been off your face while you're eating a little too long. I'm going to tell you to please cover up. Think about the mentality. I mean, these are the people the Soviets used as prison guards in the Gulag. They enjoy the little thrill of power and harassing other people. There's something deeply wrong inside of them. They didn't have to do it. I mean, that's the case I always go to, Clay, because you could have just not been a psycho and said, okay, they're eating. I'm going to let them eat their food. That's within the rules. But no. Mask up between bites. Sir, you're taking a little too long. Could you mask up between bites? The people who did that should forever hang their heads in shame because they're morons and they're sheep, and they're the reason that there are totalitarianisms that still exist to this day around the world, unfortunately. In fact, the second largest country in the world is a totalitarian dictatorship. So what does that tell you? Now, let's get into the pushback against the madness here. First of all, Florida Surgeon General, Harvard-trained doctor, Joseph Ladapo, spoke about ending the vaccine mandates in this state, the great state of Florida, under Ron DeSantis' stewardship, a fantastic place. Play 14.
The Florida Department of Health, in partnership with the governor, is going to be working to end all vaccine mandates in Florida law. All of them. All of them. Every last one of them. Every last one of them is wrong and drips with disdain and slavery. Okay? Who am I as a government or anyone else, or who am I as a man standing here now to tell you what you should put in your body? Who am I to tell you what your child should put in your body? I don't have that right.
Clay, can I also just throw in there before Dr. Oz? Also, we're going to have him on today, but we got Nicole Sapphire on later. We needed to bring some MD expertise. Here's Dr. Oz against vaccine mandates.
I would definitely not have mandates for vaccinations. This is a decision that a physician and a patient should be making together. The parents love their kids more than anybody else. I could love that kid, so why not let the parents play an active role in this? There are some states now where you're seeing an increase in homeschooling because parents are running from the healthcare system. They can't get healthcare because doctors are unwilling to take the risk of taking care of children who don't want vaccinations because it might impact the way their practices are run. They shouldn't feel pressure from the government to decide what to do with the vaccination schedule. They should do what's the best interest of the person in front of them, let's say it's a child, and what those parents desire. That's how the system is supposed to run.
The floor is yours, sir.
This is one of those situations where, frankly, COVID made me question a lot. And I bet there's a lot of moms and dads out there that are the exact same as me. I didn't question anything on the vaccine schedule for my kids. I've got 17, 14, 10-year-old boys. Obviously, we haven't really been through the vaccine process in a long time. But as soon as COVID happened, I said my kids are not getting the COVID shot. And I was looking at the data. Thankfully, they did not get the COVID shot. I think that a lot of parents out there who did get their kid the COVID shot, probably some of you are listening to us now because you were still willing to go along with the public health establishment. I have a lot of questions about why we have the number of shots that we give our kids now. I do. And look, I am not going to go through the, like you now have got a baby boy that I remember thinking it seems like they get a lot of shots. More shots than I got when I was a kid, more shots than any of you out there in your 30s or 40s or 50s or 60s got. And I just look around and I do feel like much of what RFK Jr. and the Maha moms are saying is true. It feels to me like we have a lot more sick kids now, a lot more allergies with kids, a lot more public health issues with young kids now than we used to. And I
can tell you this, Clay, this is an ongoing discussion in my house right now. And we are doing both a slow, a spread out in the vaccine schedule, as in taking time between them, and also doing a la carte system for the vaccine system, or the vaccine choices, as in we have a very good MD down here who was, look, if you're going to be my kid's doctor, I got to tell you this, you better not still have a mask up sign in your office, which does still exist in some places. So this doc lives in reality and lived in reality during COVID because he was a Florida-based doc, so he's really good. But I'll just tell you this. I said, Doc, Carrie and I were in the office, and I said, okay, so we can get this one shot, and there's another shot that maybe we get. And he basically was like, look, I was like, I don't think we need to get that second vaccine. What do you think? And he goes, no, you don't need to get that one. That one, really, I don't think. And then I said, okay, the first one, though, what do you think about this one? He said, look, I'll tell you this. He said, I've looked at the safety profile for a long time. It's gotten even better over the years based on what's in it. He's kind of a more holistic doc. And he said, I'll tell you this, what this prevents, it basically is for a form of pneumonia that babies get. He said, when I was doing my residency, it was actually in New York. When he was doing his residency in New York, babies would come in every day and die from that.
Yeah.
So he said, for this one, I would advise. It was still our choice. But those are the kind of conversations I think that need, it's a total risk benefit analysis, and, not being told, get this or you're not allowed to go to school, or get this or you're a bad person.
You'd be amazed what people can find when it's time to move out of their family home after years, even decades. We're going through the process right now of moving out of my house, and we are taking all of the family photos off the bookshelves, everything else. We are stacking them up, and I am thinking right now, even for relatively recent photos, man, we really need to get these digitally preserved, because my kids were born, the first one in 2008. And that was before everything had taken off necessarily. You had the digital cameras, if you remember those days, but you still printed out a lot of the photos. And a lot of those early baby pictures for my son are not now digitized. We need to take care of that. And you probably have got those if you got kids around my age, but you've also got tons of photos from when you were a kid, probably from when your parents were kids, maybe when your grandparents were kids. Do you want to preserve those forever and turn them into digital files? That's what Legacy Box does. They hand transfer everything by hand, one videotape at a time. I traveled down to Chattanooga, Tennessee, saw their facility myself, saw how much care they take with all of your family's memories, whether it's VHS, whether it's 8mm film reels, whether it is old camera photos, old school photos. They can preserve anything and turn it into a digital file. And right now, during the summer, right as summer's coming to a close, before the holiday rush starts, you can get Legacy Box for 50% off. All you have to do is go to legacybox.com, use my name Clay. That's legacybox.com, my name Clay, for 50% off. Get hooked up today.